name is Dr Katerega. I'm a medical superintendent of this hospital, St Kizito Hospital Matany. I'm also a gynecologist and obstetrician. Matany Hospital, or as we call it Matany, but the big name is St Kizito Hospital Matany, is a very old hospital. It has been here for the last 50 years. We have 5 major clinical units, plus maybe OPD, which makes them 6. That's the maternity ward. We have the surgical wards, or the surgical department. We have medical ward where internal medicine is done. We have pediatrics, and then we have TB, or the infectious medicine ward. And then we have outpatients, which works with us. We also have another department, which is the community health department, which is helping us to move outwards beyond just the hospital, but get back into the communities and be able to do a lot more beyond what we can handle just within the hospitals. Support departments, including laboratory and X-ray, very active. Speaking about referral, Matany Hospital is considered a de facto referral hospital within the region of Karamoja, because we are receiving patients from almost all the 9 regions or 9 districts of Karamoja. Talking about the medical demands here, we can look at especially the children's side, where we still struggle with a bit of malaria, especially during the malaria seasons. Still have a lot of pneumonias and some things which are reducing but still disturbing us, including acute water diarrhea and the rest. Obstetrics and gynecology is another major service which is given here. In this district of Napak district, we are the only hospital, and from the hospital we go to health center 3. There's no health center 4 where we can do gynecological or emergency obstetrics within the district. But also we get different regions and different districts sending us their patients also as referrals, and all managed within here, working in conjunction with the Moroto Regional Referral. We have surgical patients from every different direction. We've had a lot of trauma cases. Initially it was due to gunshots and a lot of others, but currently we have a lot of road traffic accidents causing a lot of trauma, and that also fuels our orthopedics and the surgical units. We have a lot of cases of children who require surgery, either congenital anomalies or defects which have come up due to trauma and other conditions that we may have had. And many times, despite the fact that we have a good running surgical ward and theater, we don't have pediatric surgeons, but we have 2 surgeons, general surgeons, one of them is also currently a urologist who is doing a lot of work in these areas. So many of the times when we get pediatric surgical cases that we cannot manage within, we send them out either to the referral hospital or we send them to Soroti, but most of them we send them either to Lacho Hospital, where they have camps that are done occasionally to handle these congenital malformations for the children, including the cleft lips and rectal malformations, sometimes orthopedic related surgeries. All those things are usually, we send them out from here to go. Lacho is approximately another probably 400 kilometers from here. And many times we find many of our patients or their caretakers reach a point of saying they wouldn't want to go anywhere and they just want to go back to their homes and settle down with all these problems that they have. Yeah, so these are some of the other things which we may be struggling with. We have need basically for occasionally getting people coming in to help us in such areas. We've been working with different organizations where we have to organize and send the patients out. And currently, when we get an opportunity, like what we are having now, that we have different groups coming in and offering, like now this one with the Doctors on Mission, they're offering that they can come and work with us to have a surgical camp done here, especially for the pediatric. It is something which we really welcome. It is to the advantage of our patients that and the benefit to them, because that implies that they don't need to move out to be moved out, but they can come and join and be with us here and get their surgeries, get their treatments within a place that they are used to, a place that they know, and a place where they are comfortable. Challenges which they meet outside there, one thing, sometimes it's very costly, other times it's about language barriers, but when they do it within the region, within their environment, it is always much easier for them to pick up and be able to also recover quicker with all the family and social support which they need. There are other challenges that may come up when we look at the community health. As a hospital, we move out a lot to go and not just settle within the hospital, but we move out to go and look after or look out for patients who are outside our catchment areas, but within the region. We do community outreaches as much as possible, and in such areas we find many of these kind of patients who have been either neglected or left out, or where you find that despite the fact that there is need for care, they cannot access it due to so many issues, including financial, but also the difficulties with referrals. So when we go out there and we meet them, sometimes we have to refer them or look for ways of funding as a hospital, looking for how we can push them out. But then if these services are put or brought to the place, brought to the hospital, it makes it much more easier for us to help these kind of patients. In camps which are done, there's one other very important aspect that we always welcome, and that is the training aspect that comes with them. We welcome the doctors on mission, the Amigos International, and welcome every other partner who is coming in to help us with this, to make sure that this event takes place as scheduled, probably around the mid or early weeks of April. And as we go on, we shall see how all this moves on. So thank you very much, and thanks to everyone who is working with us and giving us all the necessary support.